Good evening. I'll call to order the January 16th, 2024 meeting, joint meeting of both the FinCom and the Select Board. My name is Dennis Galvin. I am the Finance Committee Clerk. I will be moderating the meeting this evening for the Finance Committee. Our Chairman is unable to attend due to a family elder care emergency, so we ask for your thoughts and prayers for her. And we have a quorum from the Finance Committee, so we're ready to move forward.
I'll also call the Select Board to order. We've got a quorum as well.
Okay. The first issue is open forum. Does anybody have any announcements they want to extend or make? I want to thank everybody for coming out in this very cold evening, so thank you for your dedication. We'll start to take the first people first. The first item on our agenda is the Board of Health, I believe. And is there a representative here from the Board of Health?
Yep, we have Ray Dick, the Health Director, online.
Okay.
Good evening.
Good evening. How are you?
Good. Thank you so much for having me.
It's a pleasure to have you. We're grateful, honored to have you. Ray, would you like to open up with just a general statement about the financial situation involving the Board of Health, and then we can go to questions?
Sure, absolutely. So as you can see by our budget narrative, we did increase our fees for January 1st, 2024 start. We have already seen an increase in fees that have come in through our permitting system. We have our accomplishments, goals, all listed in our narrative. Any questions that you may have, you can see our revolving account is bringing in additional funding with a variety of vaccines that we offer. But yeah, I'm here to answer any questions that you have regarding our budget tonight.
Okay, very good. So we'll begin. Let's start with the members of the Finance Committee. Is there any member here, either online or in person, that would like to ask some questions? Anybody interested? Okay. Anybody online?
Christina has ring.
Okay, Christine. Okay.
Thanks, Dennis. And thanks for taking over tonight. I appreciate it. Ray, I just had a question on the immunization revolving fund. So the balance isn't exactly growing, which is good. But can you tell me what else that fund can be used for?
Sure. So we use this fund to purchase not only immunizations, but to certainly purchase equipment that we use in the field. So for instance, the state requires specific coolers have to be updated every year, which can be quite expensive. Because all of our clinics are off-site, we do cart a lot of this equipment around, including paperwork. It can also be used for things like syringes, Band-Aids. We use it to, as you can see now, we do use it for the additional 7.5 hours of our public health nurse to full-time. But with this revolving account, we've been really fortunate, for instance, when COVID came, that we were able to purchase that up front. It does take about 9 months, I will say. I just want to let everyone know that, to receive reimbursement. So that's why you'll see a real difference over the years, as you'll see here in the account.
Oh, is that the difference in when you actually receive the money? Because sometimes, right, the revenue was very low one year and then it was high the following.
Yes, like you'll see, for instance, 22 is high because we provided a lot of COVID vaccine. But over the years, folks have been less interested in receiving some of the COVID vaccine. So you'll see those changes, and it does take, like I said, about a year to receive reimbursement. Okay. But anything medical, clinical, we do use, we take out of this account.
Okay. I had one other question about your dental program. I think it was for the elementary schools, perhaps, that was cut because of the failed override. And I apologize, I don't have my notes in front of me. So were you able to reinstate that program at all, or is that not running?
So we are reinstating the program this year, and we're working with our hygienists, but we will be offering the program K to second grade only due to the cut. So I was able to receive some small grant funding to cover that for cleanings and screenings K through 2.
Okay. One last little comment was just, I was wondering if some of that revolving fund could be used for your dental program. I believe the amount of money that you needed for the dental program, I want to say was fairly small, few $1,000s or something in that range. So I just didn't know if this might be an opportunity for that.
Yeah, that is certainly something that we can look into to see if, dental services would fall under the clinical requirements of the revolving account. So
Okay.
we can certainly look into that.
Sure. I mean, obviously, if you don't get grants would be great, but okay. Thank you so much.
No problem.
Anyone else from the Finance Committee? I have a couple of questions I'd like to ask as well. Number one is, on the consulting line in the budget, this year there's a consultant listed for $1,800, but in FY '27 it's increasing to $2,800. Can you explain what the reason for that increase is?
We did not ask for an increase in our consulting line item.
Okay. It was not for this year, it was for next year. There was a anticipated increase in FY '27 to $2,800. Do you understand, do you have any explanation why?
I do not.
Okay. And I was looking at the, just as a point of public information, I was looking at the a listing of the ailments that, that you print, and it was indicated, I thought it said 56 cases of tuberculosis. Is that correct or no?
Suspect cases, correct.
And any idea where what venue, what's causing that, or any explanation at all? Can you
Sure, we
share
have
with us?
a lot of residents that visit overseas, have families overseas, different cultures here in the community. So we do see a lot of tuberculosis brought from other areas of the country. They're visiting, they might be staying here for the summer. Generally, it's 55 and older that we see, so whether it might be grandparents visiting or staying to help watch children, that kind of thing. But that is correct.
Okay. And then I just have one question for you. And this was an ongoing discussion. And it actually involves the health department and possibly the ambulance and the police. We've still been trying to get a line on what the issue with overdoses is in the town. We've been trying to do that for a long time. And one of the things that was discussed at one point was recording of the use of administration of Narcan to find out, exactly when it's issued. Now, the police chief has also indicated that the Department of Public Health is now keeping more updated records on the overdoses. And we're wondering if it's possible in the future, if you could wind up printing those along with the other ailments that you're talking about, so we can start tracking what's going on with that.
Certainly.
Okay.
Certainly. I will say, too, that the health department is a distributor of Narcan. We are licensed with the state. So we do give out quite a bit of Narcan to residents. And we're certainly happy to put that in as well.
Yeah, even if you were to just record how much Narcan you give, obviously we don't want the identities around like that, but just the number of what the Narcan is being distributed would be good.
Sure.
Okay, thank you. Select Board?
Any questions from the select board?
Yeah, I've got a question. Ray, you talk here about you have ongoing work for your accreditation. And when we looked at that the last time, that was a pretty high price tag on the contract to do that. So are you doing that in-house, or are you using grant money, or what?
We are. So we do use grant money that we have received, and we are applying in August for accreditation for the department, which will be phase 1. So we're required to put on a community assessment, a community improvement plan, and we are actually finishing up with our community strategic plan. So we work with lots of partners and departments here in town that have sat on committees to help us put those together to get their feedback.
Okay, thank you.
I had a question. Ray, just following up on the dental program for the students, do you have a sense historically about how many students are served by that program?
There is, last year, I believe, not having that data in front of me, we had about 121 students. That's K through 5 in the public school.
Wow, okay. Great, thanks.
You're welcome.
Just to follow up on that, Ray, is that a program based on need, or is it open to anybody? The dental program?
That is open to any student, and they have an option to have just a screening, or they can have a screening and a cleaning, in which we provide a booklet, dental floss, toothbrush, and like I said, some information from home, and we also provide resources when we see issues of decay and infection.
Okay, thank you.
You're welcome.
John Fryer has his hand up too.
Okay, John?
Is he on mute?
John, I think you're mute.
Sorry about that. Good evening, Ray. Just the question that Dennis had about TB just sort of popped something else into my mind. Do we track the kinds of TB that we have, i.e., you know, when people come back from abroad, in particular, certain countries, is it drug-resistant TB, or is it easily treatable, or do we sort of lose track once it's been diagnosed?
So we don't track different kinds of TB, but the Department of Public Health does. In some cases, rare, we do have to collect what's called sputum samples. We'll have to go to the resident's home. It does take time, as it sounds like you might be aware, speaking with the family, speaking with the patient, but we don't specifically test or track different kinds of TB. For instance, one example would be Lyme disease. You'll notice it might say 0 for in our records for 0 Lyme disease in town. That is certainly not true. We have quite a bit suspect and probable, but we don't test in our department for different types of Lyme disease, which there are 5 different types of Lyme disease.
Okay.
And I think just to follow up on John's question, what are the protocols with TB? How infectious is it, and what protocols are in place when someone's discovered that has it?
So with TB, it is extremely infectious. Generally, what we see is when we're notified by the Department of Public Health on these cases, we are more of fact-finding. Like I said, in the 20 years I've been here, I think we've had to collect 1 sputum sample, in which case our public health nurse works with the Department of Public Health Epidemiology Department, and we go step by step for those protocols. The same would be for any kind of foodborne illness outbreak.
And was there like quarantine and that type of thing that's involved, or
I'm sorry, I didn't catch that.
is there quarantine involved or things like that?
There are, yes, there are.
I'm all set.
And there are protocols set by the Department of Public Health.
Anybody else? Okay, I think we're all set. I can't see anybody else. So we're all set, yeah.
Yep.
Okay. Thank you very much, Ray. We appreciate it.
Thank you. Have a wonderful night.
You as well. Okay, so our next department is the Council on Aging, so, here we are. Thank you for coming out on this very cold night. We appreciate it.
Sure.
Thank you. Would you like to give a little overview of your,
I do.
All right,
I've written something. Do you mind if I read it?
not at all?
Okay. All right. First, I just wanted to say good evening to the Select Board and to Kristen and to the FinCom Committee and to town residents. My name is Jennifer Claro, and I appreciate the opportunity to be before you tonight presenting our department's fiscal year 26 budget in the amount of $627,557. We are appreciative to potentially increase the senior rebate program by 3 additional slots totaling $4,500. With the inflationary cost of living expenses impacting more older adults living on fixed incomes, this additional financial relief will bring needed relief and security. At this time, we recognize the town has worked to overcome financial shortfalls that ultimately are impacting all departments and schools. As our department does well, We roll up our sleeves to support the important programming and social services our older adults deserve and need to maintain a healthy and enriching quality of life. The Cameron serves age 55 and over, which accounts for 7,876 residents, which makes up 32.4% of the town population. As we know, the older adult population is continuing to increase, and we know it's crucial to be looking at the infrastructure that best supports our older adults. Our fiscal year 26 goals are shared in your budget, which include increased property tax rebate program for 3 additional slots, assist in advocating for more diversified housing with a focus on low-income housing between 30 to 60% of area median income, implement and monitor a plan of action to achieve our fiscal year 26 strategic plan goals, focusing on 4 core areas, which include transportation, facilities and programs, financial sustainability, and communication. Work with land use management, ZBA, and planning board to ask new housing developers to better ensure rent increases don't outpace income qualifying for renters, and financially contributing to the COA transportation program to support the increased ridership that we're seeing with new and future development, and identify additional income to support and sustain our programs and social services. This effort would not be possible without the support of our COA and Friends Board, town departments and school partnerships, as well as the community, really the outstanding community support that we have at the center. And I can't say enough about the center participants that help us with different administrative tasks, as well as help fundraise and just be additional support to the center participants as well as our staff. We are hopeful and challenged, but with the support of our COA and Friends Board, town departments and school partnerships, and town leadership, we are driven by innovation and progress, fostering a vibrant community for all and delivering a high quality of public service.
Thank you. Thank you. All right, so we'll open up for the Finance Committee. Any questions from members? Go ahead, Nate.
Thanks, Dennis. Thank you so much. Could you just, for those of us who are newer in the committee,
Sure.
just describe the rebate program?
Oh, sure, I'd be glad to.
And how that works?
Yeah. So it's for ages 63 and over, and anybody can apply for it. You do have to own your own home. We do go by a first come, first served basis. We've had participants that really enjoy participating in this program, and basically what happens is either we send out kind of an invite to all the town departments and the schools in town to ask if there's any needs that they may have, whether it's to help with filing or helping with special projects within the school. Working at the COA, we've had different tax workers work with the housing authority, just with different departments for their different needs. And based on what we get back from the towns and schools, we try to place hopefully close to about 25 seniors. And basically what the requirement is, it's about 110 hours of service within a period of time between September and March. They have that period of time to work with the department or the schools to complete their hours. And if they complete their hours, they get $1,500 taken off their property tax bill.
So, just so I understand, the funding in the budget for this under the Council of Aging is essentially going back to the individual as a rebate, and not basically just offsetting the revenue.
We have to cut a check, and then it's turned over to the treasurer collector's office, who then applies it to their real estate bill.
Okay, right. So it's that. So in that the capturing of it in our budget is in this particular line.
That's correct. Yep.
Okay. And just a follow-up question, if I may. How many, I'm just curious on the demand supply spectrum, or do we have lots of seniors and not enough spaces, or do we have a lot more jobs than we're usually able to fill?
That's a good question. So, actually, the last year, when we had COVID, of course, we couldn't do the program. And once we were able to open back up, we initiated the program, but we did get a lot of response back, and I think it's still because people were, just trying to transition out of COVID. But since we've had increases in different, whether it's property assessments or taxes or just inflationary costs with the cost of living, we've had more people that need the program than we have slots for. Actually, last year, that was one of the things that I was looking at reducing, was the property tax rebate program, because at that time we weren't filling our slots about 2 years ago. And talking with Kristen, she just felt like that would not be a good thing to do, recognizing that there was some inflationary costs that were becoming our direction. So we continued to, even though we reduced it after COVID, the number of slots, we haven't increased the slots. So we're trying to get back to where we were, which we used to have 20 slots, and the Veterans Affairs had 5 slots. So having the additional 4 slots would allow 4 more people to be able to participate.
And sorry,
Yeah, no, go ahead, go ahead.
so if you had a magic number right now compared to the demand from both the town and schools in terms of the number of this current year, the number of spots that they could use assistance with, and the number of seniors actually wanting to take advantage, what would that number be? That would be the sweet spot of getting to an equilibrium where we've satisfied at least supply or demand.
So I didn't answer part of your question, your first question, and that question was the participation with the departments in the schools. Some departments are a little resistant to participating in the program, as well as possibly some of the schools. I can't speak for the schools, just because there may be a smaller department and maybe they don't have the space, so they have such a flow that they can handle. And maybe, sometimes we've heard that sometimes, trying to train someone and having to deal with schedule conflicts can impact kind of the flow of the office. So one of the things we are kind of challenged with, like last year, is the participation from departments and schools. So right now we probably last year maybe had maybe 10 to 12 people that would have liked to participate, but we didn't have the slots, nor did we have the participation of the schools in the town.
So you lacked both funding and available spots.
Yeah.
Okay. Thank you.
Questions, David? Anybody, any finance committee members up there? I don't see anybody. I'm gonna have a couple of questions here. Just these are basic routine questions, I guess, Jennifer. So I noticed that building maintenance is up 20%, vehicle maintenance 20%, office supplies up 17%. What's driving these increases? Do you know?
I would say the increase in participation and just the building, that's a challenge.
Yeah, that's very well documented.
Yeah. Transportation, of course, is just the gas, but that's really, and the other piece too, I guess, is also our LRTA, our grant that we get does not cover the cost of the program. So we've had to use some of our reserves from our EOEA grant to cover that cost for probably the last 6 or 8 years. We have had several conversations with the LRTA saying that, how can you expect us to meet the demand of our residents when the increase is so minute? As you all know, right now we're in a pilot program with the LRTA where it's basically there's no cost for people to use the service. And as you know, our program is a donation-based service. So this year will be a little bit different, but because we're going to get paid for every ride that we provide, whether it's a ride within town, or it's a town contiguous to Westford, or it's either we're going to Lowell or to Concord. Those are our medical rides, which are our most expensive. So this will be a really interesting year for us because providing fare-free rides, they're hoping to increase the ridership. But when that goes away, if we've had a lot of increase in riders, how are we going to be able to maintain that on a donation-based system?
Well, that's a very good question. That was a point brought up even last year. So am I hearing you correctly by saying that the LRTA is going to reimburse you for
Yes, for
really?
this year, they're reimbursing us for every ride.
Wow.
Yes.
So that line item actually almost goes away then. I mean, as far as the gas is concerned, right?
Yeah, we'll be using our grant for the gas.
Oh, grant,
and
okay.
for administration. All of our drivers, all our dispatcher, they're all paid through the LRTA grant. Oh.
That's a nice that's a good development. Yeah. So the other question, how about the office supplies going up 17%? Do you know what?
Yeah, I mean, reason I could say the office supplies go up is just because we're requiring more office supplies.
Okay.
We do have like when Hal Schreiber, which he'll soon be doing tax returns. I mean, the paper and the printing is a lot, but it's such a valuable service. It's an invaluable service that we have with having him oversee that program.
And you made some, there was also an increase in the account for the social and cultural programs. Have you got some initiative that you want to accomplish this year? Or?
Oh, well, we're really excited to have done a new partnership with, it's called FISCO. It's Friends in Service to the Indian Senior Center Organization. And this is it's a 501c3, and their focus is on kind of doing what we do, but with the Indian population. And as you know, that is something that we have been striving to improve probably for the last 3 or 5 years. So when we were approached to possibly collaborate with them by providing space, so residents here in town could kind of enjoy being with their own culture, enjoy their cultural foods, enjoy programs that maybe we don't do, that they do. It was a great fix. So right now, we have seen a great increase, or we have seen a substantial increase in the Indian population coming to the senior center, and it's been a great introduction for us to introduce what the senior center is all about. It's kind of a new concept. We've got people now playing ping pong. If you looked in our newsletter, which I actually brought some because I wasn't sure if everybody receives our newsletter, you'll see that we had these 2 gentlemen in the newsletter that won a ping pong senior championship tournament on behalf of Westford. So, we were just really excited to have more diversity in our center and actually seeing people feel more comfortable coming to the senior center and getting to know their neighbors and our staff, and becoming regulars, not just coming for a weekly Wednesday lunch, but they're becoming, they're using our transportation program now.
Get comfortable.
So we're excited about that opportunity.
I have just 2 more questions for you. You raised a very interesting item for discussion, and that's the topic of trying to get more affordable housing for the elderly. You talked about that, which I think is a major concern. And I just wanted to know, can you describe what interface you have with the Housing Authority and the Planning Board and the ZBA to see if they can assist you in trying to advance that cause?
Yes, we work very closely. We've always worked very closely with the Westford Housing Authority, and we don't anticipate that will change. We do partnerships with programs. We run the RAP program, which is the Westford Rental Assistance Program, which provides rent to families, 5 families. And they can, based on the application and the income criteria, they can receive rent assistance for 3 years if they're compliant with, there's a social, a case management component to that where they're meeting with our town social worker maybe quarterly, and with the assistance of the participant in the RAP program and our social worker, they establish goals. And based on how they are doing with their goals, they can possibly roll into the program a second year and receive rent assistance every month. Usually it's around $500 a month. So it's a great program, and the goal is to be able to provide, help them get on their feet, financial stability, and, kind of be a sounding block when things kind of aren't going your way, you're feeling kind of beaten down, you have somebody to come and kind of help you, lift you up and provide resources. So that is a program that we've been doing with the Housing Authority probably for the last 4 years, 3 or 4 years, which is funded through the CPA. Regarding with the Planning and Zoning Board, we have written lots of letters of support. We've also asking them to look at diversifying housing as well as low-income housing. We have come to some hearings and advocated for different types of housing. That's, one of them was the Roberta McGuire residences. The other one, of course, is Town Farm. And I'm missing one other housing development. Yeah, it was the Roberta McGuire, 2123 Carlisle Road. We're also have been following with Drew Farms with the workforce housing, because again, even though they might not be older adults, we do have younger families that really are struggling, that are making minimum wage or a little above a minimum wage, and that need that housing to be able to continue to live and work here.
This question may have more to do with the Housing Authority, but I just wanted to just kind of explore it a little bit. When there's a potential for some significant increase in units, rental units or whatever type of units in the town due to MBTA and a few other initiatives. And when that happens, generally, there's a set aside for what you would call affordable housing, and then a certain percentage of that is also set aside for state housing. In other words, one of the concerns that have occurred over the past long time ago, I don't know if it still is that sometimes we weren't advocating enough to get our own folks in some of these particular units. And I just want to know if you're aware of that, and if you can address it, particularly elderly, getting option to some of these units and not being set aside.
Well, there's a lot of rules with lotteries. Like you said, there's a 70% preference usually for Westford residents.
Right.
I think we could possibly do a better job trying to get the word out about the housing. I always, I think that's something that we scratch our heads on, because sometimes, there is such a need for it. We hear it through our social service staff. We're dealing with people that become homeless that are residents here. And we've used the emergency housing through Westford Authority, the Westford Housing Authority, but sometimes there's not any available housing. So sometimes we're having to house people in a hotel, and that, of course, isn't a good solution either.
Yeah, right.
So do I think there's probably more that can be done to help get the word out, not just with the COA, but maybe throughout the town? I think so. Because there's also families here that need that housing support. And, our focus, we, through social services, we work with families, but, our main gust is, of course, older adults, So how do we best reach younger adults? Maybe it's through the schools, sending out these lottery notices. send them through backpacks. I don't know what schools are allowed to do, but that might be a great way to,
Well, this is the last question I have, and you kind of segued right into it. So I noticed that you referenced, you've got case management services there.
that's correct.
And you've listed 705 contracts for case management services between the ages of 18 and 59. I think this came up last year in the discussion. The question that I would raise is that exceeding the scope of what the responsibilities of COA is?
You're talking about working with younger families?
Well, yes, I
or-
mean, if you're supporting the social worker, availability for younger families, that is extending beyond what your scope is. I just wanted to hear what you had to say about that.
Well, and that's one reason we've had that. Last year, we increased our social service hours because of the additional caseload. We do have our caseworkers, Allison Christopher, who's the town social worker, really focuses on working with the younger families and the more difficult cases with older adults. And then Annette Cerullo and Jen Beal focus on providing social services for residents that are age 55 and over. We do collaborate a lot with Nicole Lavalette, the community wellness coordinator. She has a lot of strength in case management with younger families, so there's a lot of collaboration between Allison and Nicole. But what I can tell you is there has been a significant increase in case management for social services for young families as well as for older adults. Allison was hired as a social worker for older adults, but under the previous administration, it was kind of, if there's things that you can help with, identifying resources, with a younger family and you have time, can you do it? And it's just kind of grown from there. Is there social workers within the schools? I don't know that. Maybe.
No, I'm not
I don't-
doubting the fact that I'm glad that you up with it.
Yeah.
I just wonder from an organizational point of view, whether we need to look at some other function. Because that impinges your budget, right? You have to pay for those.
Yeah, I mean, it comes out of our town social worker was originally hired to be the social worker for the COA. And that her caseload has increased with younger families.
Okay, that's good, all right. I have no further questions, does anybody else?
I've got one.
Okay, go ahead.
Sorry.
I got him, and then we'll,
Okay. Could you help me understand the encumbrances line item? It's the last one on there. This may be more of a Dan question, but I'm curious what that is.
The encumbrances, so July 15th is the last warrant of the year, so any expenses that were incurred in the previous fiscal year, we have to encumber those in order to pay them after July 15th. So we bring forward that money. It doesn't close out the free cash at the end of the year. We bring it forward to pay for those expenses that were incurred.
Okay, so it's treating up the balance sheet then. So then that's cash that's then paid back in the new fiscal year for essentially like a note or something that was issued in the prior?
Yeah, so typically at the end of the fiscal year, any money that's left over from personal services or expenses is just closed back out to the general fund. In this case, we're not closing that money out. We're bringing it forward because we have known expenses that we need to pay for.
Okay, and then the timing just puts it into this year. Then.
Yep, that's right.
Okay, and then on the revolver sheets that were including some of the collaterals that were sent along as well, does that work as my familiarity with a revolver is that it's with a bank and there's a availability calculation and then you can draw up to that amount. Is that how these function?
A little bit different. So it's called a 53E.5 revolving fund. So each year at town meeting, we set the limits, the expenditure limits for each of those funds, and then whatever revenue is in there, they can spend up to that limit. So it's something that's reauthorized each year.
Okay.
Just money in, money out type of account.
And then, so for these, then, like, I'm just looking at the chart that you had sent out. When we see a sheet that shows what some of the balances are, would it also be possible to include like what the cap is, so we can kind of see like how you know, how much of that limit has been consumed versus like what's available, I guess.
Yeah, I can send out the caps, sure.
Yeah, or just as part of that sheet, just whenever
Yep.
one of these goes out, just so we can kind of see what the delta is between what's been approved and where they're, you know, where they kind of landed at.
Absolutely.
Dennis, can I just
Go ahead.
say one little thing?
Absolutely.
When you were talking about the case management also with young families, I also want to say we collaborate a lot with the health department on some of those cases
Okay.
too. Yeah.
Good, good.
Christina has her hand up.
Christine, go ahead.
Thanks. Jennifer, recently there was a space utilization type study that was done at the Cameron. Has that been completed? Can you just give us kind of an update on where that stands and if anything's going to be coming forward from that?
I appreciate that question. Thank you. Yes, the town manager does have a copy of the programming study that was done. We were not included in the facilities study because we had the study done. So that was a concern, with the community groups that are going to be going on. Are they going to have the information from our program study so they'll understand a little bit more about our facility? And I have been told that information will be provided and it will be part of the conversation.
Okay, thanks. Can you, is that program study complete?
Yes, it's been complete. I would say for maybe a year,
Oh, really? That long?
Maybe,
Okay.
I'm hoping. You know what? I'm sorry. I'm going to look at the date. August 31st, 2023.
Okay.
Okay.
Oh, 23. Okay. Can I get another copy of that from somebody? We may have been sent one, but I'm not sure
Sure.
at this point. I don't remember seeing it. Would it be possible for you to just give us a brief synopsis of what the outcome of that was?
Gosh, that's hard because it depends on how you read it. We definitely have a lot of challenges in our building with usage, with space. We definitely have a lot of challenges with parking. Like today, I hate to say it, but we had someone fall in the field because it's iced. And, we have a lot of people on Mondays and Thursdays at the center. So we are challenged with space. One of the things that we've been tasked with is to look at, doing other programs off-site, which we have been doing. I've been meeting with our Program and Facilities Strategic Planning Committee. I have to provide a report of all the programs that we're doing off-site, what the statistics are of people coming into the building. And then, okay.
Yeah, so I'm just gonna, just so I have a little bit of an idea before I actually see the study, does the study just sort of document what your issues are without really going forward to say this is what we think we should do about them and give some sort of solutions?
I think you'll see that. I think you're just gonna see problems or observations that an architect made while he was touring and working with our staff, meeting with our staff individually, talking to them about the challenges, the benefits of where we are.
Okay, and it sounds like maybe that'll feed into the facility study that's kind of going on now.
Can help answer that. So there certainly were some recommendations for changes as well. Some awnings outside, some space changes, some changes to closets and whatnot. Some of that work is actually ongoing with the facilities department. Some paint abatement, some painting. So I wouldn't say that nothing has been done with the study. Actually, quite a few things were authorized in our ARPA funding through the town ARPA funds and state and federal ARPA funds. But the Tecton Architects is taking the context architecture study under consideration when we're looking at adjacencies and shared programming spaces and whatnot for that aspect as well. And then in terms of the HVAC project, that will be revisited through our internal team with a member of the Permanent Town Building Committee over the next few months and then maybe brought for a design project at fall town meeting. That's too soon to tell at this point in time, but we are moving through that with Jennifer, facilities, and the team.
Okay, so if we were looking for any capital projects that might be coming forward as a result of this program study, I'm assuming we'll kind of see it as part of the facilities study that's kind of going on now?
Yes, that's likely.
Okay, thank you.
Anybody else from,
I had one.
anybody else from the finance committee? Are you still on more? You still want to continue?
Yeah, I still had one. I like
Okay, I'm
one or two
sorry,
more
go ahead.
questions, Dennis, can I? Thanks. So Jennifer, the revolving funds, there were 3 noted there. And I was curious about the senior center programs revolving fund and the TREAD program.
Okay.
First question was I didn't know what TREAD meant, so I was just sort of looking for a little bit of a definition on that, like what types of expenses kind of come out of both of those. And my main reason for asking is in those 2 funds, it looks like the balances are kind of growing, and so I just wanted to see if there was some sort of a plan for what to do with those funds, or something kind of going forward.
So TREAD is temporary relief for elderly and disabled. There's a committee of town residents, and basically they take applications for either someone that's elderly or disabled, and they kind of talk about what their challenges are, and they're typically very low income. So it does provide some tax relief for those individuals. They just did the disbursements, I want to say December. I think they did the awards in December, and I think people have already, or the awardees have already received notice that they qualified for it. So again, the typically the amounts, range around maybe $500 to be able to assist with different needs for individuals. And as far as another thing I would mention about the TREAD program, there's always been a concern that there's one donor in town that really supports that program, and it's always been a concern what happens to that donor if something should happen to that individual, because there wouldn't be a TREAD program at this time.
That makes a little more sense with the TREAD program. Like I said, I wasn't sure what it was for, so I'm not so concerned about the balance growing there.
Okay. Yeah,
it completely different. Yeah, I get that.
And then I think
the senior center programs.
Sure.
Yeah.
So I will. That is kind of so the money that comes in from the senior center. This money comes from programs where people sign up for classes, for meals, for art enrichment. Just various things that we offer in our newsletter. And basically, we turn around and subsidize different programs, so we can try to ensure affordability and that everybody can participate in our programs. We do have a policy if someone can't afford to participate in a class or go to a meal event or whatever the case may be, we just ask that they meet with the social worker, and if anything can be paid towards their participation, that's up to the client and the social worker to determine, and we wait to hear back from the social worker of if we're going to cover the complete cost, or if the client's going to help with $3 or whatever the case may be.
Sure.
So we use that fund to help subsidize, and we also use that fund to help cover the shortfall for our transportation program, which is sometimes between $20,000 and $28,000.
Thanks. That makes a lot more sense. I'm not super concerned now about those balances. I think that's probably a smart thing to have some extra funding cushion in there. Thanks. I'm all set. Thanks, Dennis.
Just a follow-up on on Christina's question on the revolving fund for the senior center programming. Am I reading this correctly that this current fiscal year, only halfway through the year, the revenue and fees is already at what it was for all of last fiscal year? Because it says it's at 50,926 as of January 7th. Last year, the total collected for the last 2 years was 51,000 and change. So, I mean, is that because it's all front loaded, or are we expecting to double revenue coming in that account?
Oh, we don't expect it to double, just because, again, you know, we're dealing with a lot of people right now that are stretched with their income. So, you know, we're going to be looking at we're subsidizing more. And then we also, you know, we have some of our program costs have gone up, you know, for our instructors.
Yeah.
So we have to be prepared for that. And if you look at our budget, you know, we only get, I think, maybe $2,400 for our program. So basically, you know, that 53E is coming from the participants. So we can provide the programs that we're providing.
I guess I'm just trying to understand halfway through a fiscal year how we're already at, if it's grown that much in just demand, and therefore it's going to dramatically increase the ending balance and the expenses, or if, yeah, I'm just, it jumps off the page at me.
I think it would be good to look at it for, maybe we could look at it again in May. I think you might see a little different story in May.
And jump in. Dan, is that a balance sheet account? So it just has the cash of whatever it was at that moment in time. So it's not necessarily how much they've collected; it's just how much is sitting in that account. Is that correct?
That's correct. Because
right. So
in the revenue line.
On the revolver. Are you looking at the revolver?
Yeah.
So that's that'll be like a balance sheet account. So the revenue will be just the balance that's sitting in that account, not how much has actually been collected over that period. That's just how much cash is in there at that date. Is that right, Dan?
The revenue is actually cash that came in this fiscal year. So
It did?
the
Okay.
Friends of the Senior Center actually do fundraise a lot, and then they donate money over to the.
Okay. So that was 0 as of Jan 1, and now it's 50.
No, it's a July 1
Oh,
July 1.
oh yeah. Okay. Okay.
on the fiscal year.
was that rolled up?
But that's
was our
still
EOEA
50%
rolled
through,
over into that?
a little more than halfway through.
Okay.
It was
All right.
all fees
You guys have
collected
any
from
more?
the program, so.
Any more? Any more members of the Finance Committee? All right, seeing none. Upward?
Select board?
For this. Thanks, Jim.
Okay, thank you very much.
Right, thank you.
Thank you. So the next one
If
is,
there is a question from the audience in the question and answer, I don't know if Dan can help facilitate that. It is relevant to the Council on Aging.
go ahead.
Is there an opportunity to partner with the FISCO events to offer informational presentations on town topics or meet and greets with town officials?
Can you read that one more time again? I'm
Is-
sorry, I don't have my glasses on.
Is there an opportunity to partner with the FISCO events to offer informational presentations on town topics or meet and greets with town officials?
Yeah, so what I would do is I would connect, let's just say, Burley, that, is it Valerie? Valerie?
That's Valerie, yeah.
Valerie, sorry. Valerie, with Rita Shaw, and who is the executive director of FISCO, and that would be a conversation that they could have. I'm sure they would be glad to, you know, work with the town. It's a wonderful group of people. Anshu is lives in Westford, and she's actually the director. So she has again, she's local, and you know, like I said, the whole point is to provide programs and services that can enhance, you know, everybody's life here in Westford, and whether it's educational or to learn more about the town. I'm sure they would be very open to having that collaboration and partnership. I think that would be very supportive. But I would definitely be glad to connect whoever would like to be to the executive director to have additional conversations.
Yeah, might be a good opportunity for Chris, as part of our communications. Chris, I don't know if you can hear me mumbling over here to Scott, but it might be a good opportunity to reach out to that group if we haven't yet, just as part of our communication strategy. Another
Yes, absolutely. Jennifer and I have been in communications about the group, so we will have further outreach.
Okay, thank you.
Thank you for the comment.
Okay, Jennifer, thank you very much.
Thank you.
Stay warm. Our next item on there is public safety. Now, I'm gonna propose, we have,
Veteran services.
veteran services. How can I forget the veteran services? Mea culpa. All right. I'm sorry, go ahead. Terry, you're up.
If I can figure out how to unmute here. Can you hear me now?
Yep, you're good.
Well, Dan and Kristen can answer most of the questions here. As you know, I'm the interim veteran service officer at the moment, recalled back to active duty, Dennis. So anyway, we're doing very good. The budget's pretty much on top of what it has been in the past. The biggest issue, the biggest concern, any kind of a variance in our budget will come from our Chapter 115 support. And Dan and Jesse and I have already been in discussions is that we have one of our recipients is unemployed due to a medical issue, and he is an employable person, so we're paying him the max, which means that we actually ran out of our Chapter 115 budgeted money here in January, and are going to requesting a $2,700 increase to finish us out the rest of the year. But those are unexpected expenses that come up. Other than, there's really aren't anything. We try and get these folks off to other federal programs. We get about $5,000 per for 220 some residents that get VA monthly checks on an average of $1,200 each. So we have a lot of funding. We try and move people off of local aid and get them off to the federal programs, which is Chapter 115 is a safety net, and it basically is meant to cover when other things don't. So it's kind of last on the list for support. But we do run into those cases once in a while. SSDI applications are taking anywhere from 250 to 300 days to process. And it's just, when we check monthly with them on our open SSDI applications for some of these folks, and they say it's in progress and they have all the information they need and still making decisions. So those things come up, and we got, according to our census here, we have about 700 veterans active or veterans in town. They'll have voluntarily registered themselves through the senior or through the census form. The largest population, believe it or not, has shifted from the Vietnam era to the Gulf War era veterans. So our oldest veteran is 98, our youngest is 22. Just to kind of give you some of the demographics for our community. But we have, I guess that's most of the information is as you see it in the notes there. Anybody have any questions?
And I'll just, if I may, augment Terry's comments. We really appreciate Terry coming back from retirement to serve our town and serve our veterans. He's been a huge support and has done a wonderful job. Just to forefront some of the questions that may come, we've been having conversations over the course of my time here about regionalization of veteran services. I was very active in seeking out regional services, especially when the former veterans agent gave their notice. And we explored that very in depth with 2 different veterans districts. And our determination was that us joining those districts may have lessened the cost to the town of Westford slightly, but our services would have been greatly reduced. The outreach would have been greatly reduced. So at this point in time, it's my recommendation to move forward with a full-time veteran service officer for fiscal year 26. We will be posting the position within this month, and we will be seeking out other municipalities who may wish to join the town of Westford, but based upon the research and the investigation and the conversations we had, we don't feel that it's in the best interest of the town of Westford to join another regional district at this point in time.
Any questions from the Finance Committee?
Just a general one. In this context, how do we define a veteran?
Sure. A veteran by law, federal side is they have to have served 180 days of service during active duty period. We do consider any National Guardsman or reservist that served 20 years or have retired from the National Guard are also considered veterans. We're much more lenient in putting veterans flags out for anybody that served on the flags of our deceased veterans, of course, so we try and a recognition of their service. But for a lot of benefits, it's based on, for benefits federally and state, those numbers are variable depending upon what eras they were actually in the service. Non-wartime versus, peacetime in this case, versus wartime.
Thank you.
I just have one quick question. Terry, what is Chapter 115 support? Can you describe what it is?
Oh, sure. Emergency sheltering, any kind of medical assistance. So what we do is we look at our baseline is 200% federal poverty level. For a single person, that's what, $2,500. For a family of two is about $3,400. So that's our baseline. So we have a tool that we plug in anybody's income, Social Security, multiple sources of income. They have to show there's a whole list of things that they have to show that they're financially able. It's, again, as I mentioned early on, it's a safety net. So it's public welfare, so it kind of follows the same parameters as that. So that we cover everything from helping out with fuel assistance, living, rent. We work on that. Any medical conditions, like I said, we pay for out-of-pocket medical expenses. We reimburse them for their Medicare if it's taken out of Social Security. So there's quite a few options that are available to those, even our surviving spouses. So the surviving spouse of a deceased veteran is also eligible for the Chapter 115 benefit.
What's the source of the funding? Is it the federal government, or where's the money coming from?
Chapter 115 is completely a state program. It is unique. We're the only state in the country that provides it. It's most every other states, use just tap into the VA. Anybody that goes to a service officer in any other state, including New Hampshire, wherever, they send them off and they'll do the VA funding only. So they get pensions, death indemnity, clients, compensations, service-connected disabilities. All that comes through the federal side. But here in Massachusetts, the Chapter 115, in some sense, has been around since the Revolutionary War.
Okay, good.
A long-time program, and again, it's very unique. There's some confusion. A lot of people think I'm the VA. We are not. We are the town of Westford's Veteran Services. A lot of people say, "Well, I'm gonna go see the VA agent." Well, we are not. We're veteran service officers, and coincidentally enough, throughout the 49 other states, they're called service officers when they work for the federal government VA too. So obviously there's a lot of ways to get confused.
Very good. Thank you. Thank you very much.
You're welcome.
Board of Selectmen?
Nope.
Okay. So now we can move into public safety, I would assume, right? Thank you very much, Terry.
Thanks, Terry.
You're welcome.
Public safety communications is next. I think we should probably take that as it is, separate. But then I was gonna suggest that, when we bring up the fire department, that we do the fire department as well as the ambulance at the same time, because it's so intertwined, it's easy to understand. But, if there's any objections to that, that's what we'll do. We'll just start off with public safety alone first. Public safety communications, then we'll move to that joint discussion. So, how are you?
Not too bad. How are you doing?
Good. Andrew? All right. Would you let us know who you are, and also, if you want to give us a brief overview of the situation with your department?
Yeah, absolutely. So my name is Andy Sherman. I'm the Operations Administrator for Public Safety Communications. I've been on for a little over 3 months now, so get my feet wet. So we're looking at a 2026 operating budget of $936,084. We're fortunate enough to also rely heavily upon a 911 support grant, a 911 training grant, and an EMD grant that we apply for and receive annually from the state 911 department. This year, the support grant got us $83,046. The training grant got us $33,802.65. And the EMD grant we received $28,052.25.
Any questions from the members of the board, from the finance committee? Chris, any questions? Anybody questions? I have a couple. So there was a discussion, this was before you came on, Andy, but there was a discussion about eventually moving towards a sort of regionalization of the services. And maybe Chris can interject on this. Has any effort been done or made to try to begin that process?
I can help answer that, Andy. So I've had several conversations with area town managers related to regional dispatch services. I've also had conversations with the current police chief and the current fire chief. Andy and I have not had those conversations. He's still getting his feet wet. At this point in time, nothing has come to fruition related to those conversations.
Okay. All right. Members of the board. Select board.
Questions?
Andy, you have 11 full-time employees?
So right now we actually have 10. We are budgeted for 11, but right now we're running with a staff of 10 full-time employees.
So how many do you have on a daily basis?
So right now we run with a minimum staffing of 2 people per shift, which is a day shift of 7 a.m. to 3, 3 p.m. to 11 p.m., and then an overnight of 11 to 7. We have a minimum staffing of 2. With 10, we're able to run with 3 telecommunicators on board for a few shifts during the day and the afternoon. An 11th telecommunicator would fill a third for most day 3 to 11 shifts. As of right now, we don't have the people to fill it for 3 people for the overnights.
Yeah, you're on a 4 on and 2 off?
That is correct.
Same as the police?
Exactly, yes.
That kind of stretches you a little bit, doesn't it? That limited manpower?
It does. We're fortunate enough to have the 911 support grant. A lot of the overtime comes from that grant, so that offsets the cost of not being up to full staffing at the moment right now. Once we do get to 11, the overtime costs will be reduced significantly, and so yeah, will be a step in the right direction and definitely give us better manpower for the shifts. Between day shift and 3 to 11.
So you had those 3 grants. Were all of them personnel related, or how did they?
Yeah. So the support grant covers personnel, where overtime shifts, things like that. The training grant supports different things like I actually, now being brand new, I'm going through a lot of different trainings that covers that. It covers continuing dispatch, education hours for all of the telecommunicators, things like that, so on and so forth. And then the EMD grant, that goes directly into the quality assurance, which is called QA, of the 911 medical calls that we do. We do call review to make sure that we meet the standards of the state.
Just a final question. I think your predecessor told us, I may be wrong, but what's your optimum number for manning? Is it 11 or 12?
So it would be 12,
That's
but
what I thought.
with the lack of the override last year, we were unable to get a 12th position, unfortunately. I know that, the town's in a critical situation when it comes to the budget, so something, that might be for some time down the line.
Okay. If there's no questions here, no questions from the board, I guess we're all set. Hey,
Thank you, guys.
Thank you very much for
Appreciate
coming
it.
out here. Appreciate it. Thank
Absolutely,
you very
thank
much.
you.
Good luck to you.
Thank you. Have a good night.
Okay, so, fire department, as I said, we'll cover if there's no objections, we'll just do them all. But I thought for discussion purposes, if we could walk it through fire department related matters first, then move to the ambulance, and then, that way we'll keep it all together, because you have to pay attention to this. This is a very interwoven operation, and it's very important to, if they're not aware of it, a lot of folks haven't been aware of this yet, so you're gonna have to explain, I think, to them how that interconnection works.
Okay.
Good evening. I want to thank you all for having us here. This is Nick Demmons. He's the office manager. I have firefighter Bill Olson behind me in case you have any questions related to the ambulance side. As many of you know, the town's growing. We had another banner year with call volume. We went up another 4.61% in calls. Our ambulance calls went up from 2,100 to 2,300 and change. Transports went up as well. We had a pretty good year with collections on the ambulance side. The overall budget between fire and ambulance is just over $6 million. One of the variables there is the firefighters are currently working with their current contract, which that has been, they're in negotiations now. So that's a variable that we just don't know on the personal services side. The fire budget's about 4.4 million. The ambulance budget is 1.5.
All right, so are there any questions from the Finance Committee? Anybody want to open up? Go ahead.
Can you just describe in your budget? There's the line for education incentive. Can you just describe what that is and what the money's used for?
That education incentive is based on within the contract, the firefighters contract. They get money for their education for degrees, certifications, as well as the chief, myself, and the deputy chief get education as well. So that's what that educational incentive is used for.
Okay, so that's not that's just compensation based on credentials. Either they have, or if they earn an additional one.
Correct.
They could get an additional amount.
Correct.
Okay, thanks.
You may want to, there was a question that was submitted, and I think it's an interesting one. You may want to explain the supervisory structure. As I understand it, you have basically four lines, and each line has a captain and a lieutenant assigned to it. And there was some question about the amount of supervision that was provided. And can you explain how the supervision operates and how it functions with these individual lines?
Yep. Sorry, I want to back up in case some of you don't know. Mike Denny, the newest fire chief.
I'm sorry.
I got promoted last month.
We thought everybody knew you, Mike.
I have less time than Andy, but I forgot to add that in. So the fire department structure, the command structure, is based on an NFPA guideline, National Fire Protection Association guideline. They recommend having a supervisor for every 4 to 7 firefighters. We run 10 firefighters optimum, where our full staffing's 11. Obviously, we have 2 shifts that don't have 11 because of the failed override. We do have some openings too on top of that. So what we have is we have a captain and lieutenant for each shift. So the captain runs the shift, the lieutenant generally runs a specific company, specific outline and firehouse. If the captain's out, the lieutenant is in charge. If the shift falls to 10 or below 10, we generally fill the overtime. That might be a little bit confusing.
How about on-scene operations?
So on-scene operations, the captain is the incident commander. The lieutenant is inside operations. So the lieutenant is ultimately responsible for the inside during a fire, radio and communicating with the incident commander outside, who's the captain, on what the conditions are, actions and needs within the structure.
For anybody that, I think Danny, Dan, I think you distributed the little comparison scheme that we sent out. I mean, we did a comparison of the fire department staffing with other towns. I think you should have got it. And I mean, from what I can see, on the towns that we compared it to, Westford's pretty economic. It's, I mean, there's some places that have battalion commanders and everything else. I mean, this town has a captain and lieutenant.
We have a captain and lieutenant per shift.
Yeah. So, any questions on that?
Just so you know, the NFPA, the optimum is 5. So if we have 10 firefighters, we should have 2 officers on a shift for proper span of control.
Obviously, I don't see anybody here. Obviously, the bulk of the work is ambulance related, correct?
We do a lot of ambulance.
How many actual structure fires did you have last year?
So 16 actual house fires.
Okay, and I know that you conveyed a couple of issues Can you tell us a little bit about the cost to run an apparatus, and also the issue that you just had with your mechanic?
So yeah, that's another variable which we've been talking with Kristen and Dan over. Our member, who's been our mechanic for 27 years, has just announced his retirement. So he has saved us a considerable amount of money over the years. Just last week, or a week and a half ago, we had an engine not power up on Boston Road, and it was in the midst of rush hour traffic. So we had to get it towed, but we got it towed. He was able to fix it. It was back in service within a couple hours. So those are things that, I mean, the maintenance budget on the fire side and ambulance side, those are for better words, we're gonna take, the cost is gonna be exorbitant depending on the age of the trucks and the cost of the labor and parts.
So how much does it cost you to run, what's one run cost this now?
It used to be about $1,000. That would calculate fuel costs, and the personnel in the trucks. Obviously, fuel costs have gone up since the last time we did that tally. So
Any idea what it is now, 1.5 or?
I would have to do a calculation based on mileage and average mileage to a call and back.
Okay, and the last question that I have related to the fire department is, we just had a conversation with the Board of Health, you were here to hear it, right? And we have interviewed the police chief as well. We're trying to get an idea of what the Narcan situation is, or the overdose drug issue is. You folks administer Narcan on the ambulance calls and things like that. Have you got a tally at all on how much that you used last year at all?
Our department did not administer any Narcan last year.
Really?
Narcan is very readily available. You can get it at CVS, you can get it at Walgreens. Board of Health gives it out, as you heard Ray discuss.
Yeah.
When we get the call for an overdose, generally the person's already been administered Narcan.
Okay. All right, so that's, it used to be, you had the exclusive rights to it at one point.
Yeah, but now it's just, I mean, it's in a spray form, and people can give it, and generally speaking, whoever overdoses, whoever's with them, has the stuff readily available and gives it to them. So when our people get down there, we're just monitoring them and figuring out the next steps, whether they're gonna be transported or not.
Okay. Cool. Any questions? Go ahead.
I have a question just about the overtime line. So, I mean, that's about just under 25% of your your call firefighter line, or your firefighter line. So is that, first of all, I noticed that in the FY24 actuals, it was substantially higher, which makes me think that there's probably a chance it would be substantially higher in the following years as well. But I'm just wondering, how do you balance that with actually making determinations on whether or not it would be more fiscally prudent to hire additional full-time individuals?
Good question. I mean, the overtime is based on the firefighters' earned time. So they earn vacation time, personal time, they have sick time. The biggest variable we don't know about is the injured on duty. So we have, historically, every year we have firefighters getting injured on duty. Thankfully, it's not a long-term injury, but it does cost us additional money to fill those positions because they're unable to work. The comparison, I don't know, when you hire a firefighter, you gotta pay benefits. So that's a big variable,
But that's not coming out of the overtime line, the benefits.
Not the benefits, no, they're in a separate budget, but it's just one of those things where you're weighing, is it better to have more overtime and
Oh, I see. I understand.
finding that balance, yeah.
One of the things I did do a study with area departments that are similar size to us, and we found that the mean, we're significantly under budgeted for the overtime budgeted.
Sorry, you said
Under budget,
Okay.
under budget, yeah, compared to similar towns of our size, and then same with the expenditure part.
Okay.
So we do pretty well with our overtime budget.
You did, we discussed that when we came to see you, and just correct me if I'm wrong, but I thought you also added that some of that increase is a result of anticipated contract negotiations coming up as a result of what the outcome might be in contracts, right?
Yeah, the overtime, we generally increase, how much do we increase it? Oh, remember?
I don't remember off the top of my head. I usually just try to base it off past year
Past
spending,
years.
and then try to increase it to keep in mind increased wages due to step increases.
And your contract is due for settlement when? I mean, is it when does it expire?
It's already
It's-
expired.
it-
Oh, it has
It
expired.
expired in June 30th, so they're working with the current contract, so the rate of pay and the overtime and everything is just continuing to what they had prior to June 30th.
Okay.
So does
Go ahead, keep
does
going.
that mean that at the forgive me because I worked in different collective bargaining processes, but would that mean that once the contract is settled, in this case for the firefighters, that there'd be retroactive pay to the beginning of the contract that's not reflected in the FY25?
That's
and
correct.
26
We
budget?
keep that pay in the comp reserve for the
That's the
town,
comp,
which is
okay.
in the 152 HR budget.
Got it. I remember our discussion on that. Thanks, Dan.
Is any of that possible increase sort of baked into the 26 budget?
No, we keep it in the comp reserve.
Okay.
It is, well, it is in the town budget, but it's not
Right.
department. It's in a
Oh,
separate,
I
there's a
see.
separate pot
Okay.
for future compensation negotiation.
I have
Any-
one more.
Any, all right, select board?
Just, so, because of the override, we're now operating a few positions below what, the study that we did a couple of years ago, looking at the call volume that we serve. What are some of the consequences to either to response time or to stress on the team, wear out on the team of being understaffed relative to what we'd like to be?
One of the things is the calls are becoming more complex. With less personnel, the ambulance goes out with 2 people. If they need a third person, we're kind of taking an engine out of service because we don't have the staffing to keep it at that level. And with the closure of Neshoba Hospital, our times at the hospitals, I mean, last week we had ambulances there waiting an hour. So that's a significant hinder on our response, and the guys and girls. So, that'd be the biggest thing, is the calls get more complex, longer response times. So that's what we've been seeing.
So it's pulling more people out, and that can have a response. I mean, if you're pulling people out to address ambulance calls and you get another call, that's going to affect your response.
Yeah, so, I mean, like the other day, both ambulances went out 3 times each before noontime. So, it's quite busy.
I just want to make sure we're taking an opportunity during these discussions to highlight the costs of not having the staffing at the right level.
One of the things you can't put a price on is the mental health part, so if you have less personnel doing more work, that affects the mental health, which is concerning, It also opens up the chances, because these firefighters are working longer hours, it opens up more chance for injuries and such like that, so those are things we're trying to keep an eye on.
Yeah, and I know your team works really hard and is going to pitch in and try to cover and make sure nobody's left, with anything less than the response time that we hold ourselves to here in Westford. But just please keep the select board informed of what you're seeing, because we don't want this problem to go unobserved, and we want the town to understand what's happening.
Cool.
I just had one more.
Go ahead.
Yeah, so just looking back back to fiscal '24 and kind of rolling forward a bit, the maintenance line looks a bit volatile, where it was pretty high in '24 and then it dropped back down for '25. At least the budget did. And I understand you're dealing with heavy equipment, so that's probably you're taking a flyer when you're guessing what that might be. But was there some kind of one-time event in '24, or is there a reason to believe that it will be more stable or less in the future?
As the apparatus, fiscal '24, our ladder truck, which we graciously ordered, taxpayers voted in last year or the year before, that ate up a considerable amount of the budget, but our apparatus are aging, so that's gonna incur more costs. Like our engine 1's 10 years old right now. That's been going out of service quite a bit. One of the ambulances has been going out of service quite a bit. So as the apparatus ages, it just incurs more costs. Stuff breaks. The traditional, you think it's gonna be fixed easily, ends up becoming a bigger problem.
Yeah, so that if for like kind of 26 and just sort of like rolling forward here a little bit, then does that assume, are you kind of assuming then that some of the older or more problematic pieces of equipment then get replaced over that time?
We're trying to replace them. That's a capital expenditure we requested, and we try to replace them. We try to get ahead of the curve. Unfortunately, there's a lag time of 4 years right now to get these new engines and ladders. An ambulance, once you could get in 6 months, is taking 2 years. So supply and demand is tough.
Yeah, there's also an issue about fire apparatus manufacturing, right? It's not quite as robust as it used to be. Is that fair to say?
I think they're feeling a crunch with the employees. Like, they don't have enough employees to keep up with the demand, just like anybody else does. You know, it's and the trucks are built, but you generally they don't stop building them until 4 months before you're due to get it. So
what do you, with the loss of your mechanic, how do you anticipate that's going to affect your costs?
it's going to affect it. It's going to add a cost to it. Like I said, we've been talking with Kristen, we've been talking with Dan and DPW director and stuff, and trying to find a solution to it. But the firefighting equipment requires specialized certifications, and those certifications are tough to come by. Our mechanic right now has all those certifications because he's been our mechanic for 28 years. So because you work on heavy equipment or heavier trucks, like up on the DPW, you need to have the specialized certification that falls under the National Fire Protection Agency. It's fire equipment. It's just they put another realm of certifications into it, which is difficult. And we're not the only ones seeing it. I mean, there's other departments across the state that are, there's other towns that their mechanics are coming near in retirement too, so they're in the same situation. And I believe Kristen, correct me if I'm wrong, we did look at regionalizing and reaching out to other towns, but everybody had the same problems.
Yes, that's correct. I mean, we continue to have those conversations and not push that aside, but that is correct.
Okay, is there any further questioning for the fire side of this thing? Anybody have any questions? Because I'm going to move into the ambulance side. All right. So, can you explain the way that the costs of the ambulance service are basically paid for, so everybody has a good idea as to how that works?
So the ambulance budget it pays for 9 firefighter paramedics. It also pays for associated equipment, medical supplies. There's money that goes into the ambulance enterprise account. There's a certain percentage that Dan can talk about how the percentages are broken up, but that money also goes into an enterprise account, which helps us buy ambulances, equipment for the ambulances, and so on and so forth.
Right, so we have to replace the ambulance every 3 years, give or take. I think the last one is about $532,000. There's other capital items such as like cardiac monitors that you'll see coming up on the warrant this year. So we want to bank $200,000 to $300,000 in retained earnings each year in order to be able to save up and buy those ambulances. Last time we did have to issue bonds for the ambulance just so we could get that ordered because they're about 40 months to get in at this point. 40 months?
No, the ambulance is less.
Ambulance is
the
less.
Ambulance a couple years.
Truck is 40 months.
Yeah,
So a couple
truck's
years for the
40
ambulance.
plus months.
But we wanted to get that ordered so we don't run into trouble down the line. So I believe in FY24 the ambulance enterprise raised about $1.2 million, and that was against a revenue projection of about $850,000. So we were able to bank about $350,000 into that, so we can start saving up for ambulances.
So how do you get paid for the service?
So when the ambulance transports a patient to the hospital, the registration people at the hospital takes down their name, number, insurance information. What the in turn, that individual gives the firefighters a face sheet with their demographics and insurance information. So what we do is I collect that every week, collect a pile of them every week. I put together a file of ambulance face sheets and send them off to a billing company. The billing company takes those and actually bills the insurance companies appropriately and or the patient, depending on the situation, car insurance and stuff like that.
And now, with regards to that, much of it is reimbursed through Medicaid or Medicare. Is that correct?
Well, our payer mix fluctuates every year, so it depends on obviously the calls we go on and the demographics of the people we transport. But I can't predict what those are. Every year it's different. Like there's private insurance, there's Medicare, Medicaid. There's the other federal insurances that
It's a mix. It's a mix.
Yeah, it's a mix,
Yeah.
correct.
So of the Medicaid billings, we had this conversation last week. Can you explain what the reimbursement is as regard to the actual cost for the service?
So Medicare, Medicaid is a federal insurance. They set they set the rates. We can't bill we don't collect any more than what they set the rates for. So on top of that, the private insurance like Blue Cross Blue Shield, we have a contract with them. So we have an agreed upon price that we collect for every Blue Cross Blue Shield patient. So the Medicare, Medicaid is based off an annual, they increase it annually. And this year here, I think it's up to $724. So we're not gonna collect any more than that for a Medicare or Medicaid patient.
And how does that compare with the cost per run? Like how much does it cost to run, and how much are you getting reimbursed through that?
So we bill for an ALS run about $3,100. So that's depending on medication and interventions by the paramedics. So that all comes out of the ambulance enterprise. The cost associated with that.
Is it one for one, or does it come in less?
What's that?
In other words, does it provide you the full, it doesn't obviously provide you the full reimbursement if it's only $700, right? Yeah. There's a thing, watching the ambulance for many years, there's a thing called bad debt. Can you explain what that is?
You got it better?
Sure, it's a debt that we can't collect. Either, per our policy, for Westford residents, we don't collect from them. So we write off that debt, and then, if we have somebody coming through town that we have to transport, and then they disappear after so many months, we do write that off because it's very unlikely that we'll collect that receipt.
There's also, the federal government also sets a rate that we can't collect if a patient owes us less than $500. By law, we can't go after them for that. So that's another one.
The watching the account, the bad debt has varied from time to time depending on how good the collection process is, and sometimes just mere luck. How did it work out this year? What's your situation with the debt, the bad debt?
I think it's doing better than last year. So
I thought it was too.
Yeah.
116 for what? It was about 116,000 for Westford residents, and then collections wise, it was about the same.
Yeah.
So
I mean,
the collections wise part is that's based off people we can't find. They just choose to ignore the bill.
Okay.
Stuff like that. The Westford residents is based off of what we can collect based off of the policy that the select board put in place many years ago.
All right.
I just want to clarify the ambulance. It's yeah, we get revenue from it, but remember the service we provide is invaluable. I mean, what the paramedics can do on the side of the road, if you have not experienced it or seen it, is absolutely incredible. They can cardiovert you. They can give you medication to change your heart rhythm. They can intubate you if you're not breathing, and do all that stuff. It's like I tell people, it's a moving emergency room in theory, and they train regularly along with the rest of the firefighters, and it's a great service to the town.
Does anybody else have any questions on this? Go ahead.
What is the third-party billing? Is that a new arrangement?
No, we've always had a billing company.
Okay. And do they approximately what percentage do they take?
They 3%. So we put it out to bid in August of 23 or July of 23. The bids came in, 2 companies bid. The one we've been using, they came in at 3%, and the one that bidded against them was 4%. So we have to go back out to bid for that next year. And I gotta be honest with you, the billing company, the money we pay them is worth it with all the federal laws and all the stuff. They really know what they're doing, and they chase the money. And when they have questions, they call me or Nick.
Yeah, and it's improved significantly over the last 10 years. When I first started to engage with this, you used to have the deputy calling, making all the calls, and there was but the collections have gone up. I think you're getting the best you can get out of it.
We are.
Yeah.
And
So
it's the call volume's going up, which in turn brings revenue up, and the firefighter and paramedics, they're doing a great job doing what they need to do to obtain what they have to obtain for the insurance companies.
yeah, you may just want to add, might explain. Oftentimes, when that ambulance rolls, an engine rolls with it. Can you explain why that happens?
So obviously that we have 3 staffed firehouses, so the engine in that district rolls out with the ambulance to provide additional manpower. With these, when the paramedics get on scene, it requires additional help, so that's what the engine goes for. But also the engines at station 3 and 4 actually make it to the scene quicker than the ambulance, because the ambulance got to travel from up here. So if the ambulance needs a third person, they can take someone from the engine as well, and we're not pulling somebody from up at headquarters to go down and drive around. And
Is there any other finance committee member that has questions on the ambulance? Select board?
One of the recommendations of the Budget Task Force was to look at the billing rates for the ambulance. Is there an easy way for you to give us a sense of what the outcome of that work has been and what the improvement's been like?
so last year, I calculated what we collected versus how many calls we transported, and the mean actually increased $10. So I think that was a reflection on the increase in the increase in the rates, but also the increase in how many calls we went on. It's a tough number to get, but when you compare it to other communities, we're right in that mix. Other communities with same call volume are about $630, $640 mean on collection. The rates did go up this year, so the select board agreed to, as the rates go up from the federal government, the billing company automatically raises the rates according to the set amounts. So they did that already. The ambulance company did that January 1st. The billing company.
Thanks.
Question?
We have one question in the chat too from Heather Fitzpatrick.
Go ahead.
Sorry. So would any of the mechanics in highway be able to be certified? I believe Chris was going to answer.
Yes, so certainly we could have employees be certified. The real problem is manpower or people power per se. The highway mechanics are already out straight with repairing the facilities and the fleet that we have there. So we would have to supplement with one or more mechanics up at the DPW garage in order to satisfy the requirements of the fire station.
There is a significant amount of time that our mechanic spends on apparatus, on duty and off duty. So, I mean, he was here all day today to get one of the ambulances back into service because the front end was loose. So, he does a great job.
I assume that they'll be putting a posting out to see if we can get a replacement, or?
We're working on it.
Yeah.
We have several other openings that we're working on trying to fill. But the mechanic one's gonna be a tough one to replace.
It's a critical one. Is there any further questions for the ambulance from anybody?
Just one on the heels of your question is there anything that's new or different about the equipment that you're acquiring now that makes it either easier or more difficult or more challenging or more specialized to sort of repair? Just looking at the, compared to your experience in the past, I'm just kind of looking at how it rolls forward and, wondering what the impact might be of losing this person.
So he does a lot of the maintenance of the trucks, and he does a lot of diagnosing what's going on. But there is certain aspects of the trucks and the equipment that he does not have the ability to fix, so we have to send them out. For instance, like the new emissions, DEF, he cannot do anything with those. Those have to go out to a specialized mechanic to fix those DEF systems in the trucks. But he does the oil changes, he does the brakes, he does problem shooting, he does all that kind of stuff. But certain aspects of the truck and the electronics, he cannot fix because he just doesn't have the capabilities.
I think it's fair to say that the interface between mechanics and electronics has really increased over the few years, right?
Yeah, it has.
And what's DEF?
It's the diesel exhaust.
Oh, like a
filter.
Diesel particulate filter
Yep,
kind of thing?
it's exactly what it is.
Okay.
Yep, and that causes some problems.
Okay, so I'm gonna move on to emergency management, so don't go away yet. All right.
This is an easy one.
Oh, that's good, I'm glad you're thinking of it. First of all, is there any questions from the finance committee on emergency management? Anybody have anything that they want to ask? Okay, I have a question. in the FY '25 budget, and maybe Danny can answer this if he knows. The FY '25 budget item was $4,000, okay, but it is now increased to $10,000. What was the reason for the increase?
I think it only increased for that 2% because of 2 co-directors.
Okay, now this is a question we had about the co-directors. You know, I'm, correct me if I'm wrong, but I thought there was a point in time when the fire department, and the fire chief and the police chief offset, they would alternate as the emergency director. And I think you informed me that that's not the case.
There's been co-directors since early 2000s. There's
Okay.
been 2 people, and they share the role, but they each get a stipend for the role. And it was Tim Wickham, Communications, and then Chief Targ. Chief Targ is still on as a temporary basis, filling in for the next couple months.
Right, so I have Chief Targ appointed as the sole emergency management director right now, while Chief Dennehy and Andy Sherman get up to speed. And then after assessing this for a few months, I'll make a determination if we go back to co-directors or if we have a singular director.
Yeah, 'cause I do remember when it was one, but that's the point. So I have no further questions. Select board. No?
I see none.
Okay, that's what I have. I think the only question I think we have left really now is the animal control officer, which is not within your responsibility.
No, I'm good.
So that's one thing you don't have to worry about.
Thank you.
Thank you, Chief, and congratulations on your appointment, and good luck to all you and your staff.
Thank you. Have a good night. Have a good night.
Good night now. So the issue, the last issue was animal control, which is a kind of a small item, but a very interesting one over the last few years. This time, there's a significant increase in the vacation sick and emergency overtime, which spiked from $8,000 to $21,000 from last year to this year, about 135% increase. Can you explain why that happened and what the intention is behind it?
Absolutely. So, just for the department, we have 2 part-time animal control officers. One works a set schedule of 12 hours per week, the other 8 hours per week. And then they get called out on, for emergencies. So if the resident calls, they'll respond. And they get paid for 3 hours when they're, per call, when they're called out after hours. In FY '24, we were just paying everything out of the animal control officer line. And then when Mike Edwards came on, we looked at that. We wanted to sort of break up the regular hours that we had, the 20 per week, and then any of the emergency overtime that we had on a separate line item. So we started doing that this year, and for next year, this is sort of like our run rate. We were underfunded in FY '24, and we had to use some comp reserve to actually fund that. You'll notice that we spent $47,000 on personal services in '24, and we're only budgeted for $42,000 in FY '25. So we'll keep an eye on that going forward. We may have to supplement that again, and then in FY '26, we have a more realistic figure of just under $51,000 for the services there.
The reason why it's an interesting item is I remember, I think it was 4 or 5 years ago, the line item was kind of starting to run away, and we brought it back in pretty good. I think there was a change in arrangement of how the animal control officers were going to be paid, things like that. So I just was interested to see it spike back up again. So this is something you're gonna keep monitoring. Is that what it is, or?
Yeah, we'll always watch it, but this is one of the tougher ones to budget for because it's more of a variable after-hours budget. So, but in FY '24, we did spend $47,000. We're budgeted for $50,000 in FY '26, so it's sort of in line with how we've been running.
All right. Are there any questions about the animal control? Go ahead.
Or just a general one again. I'm new to this, so there's a recurring
Feel free to
line
ask.
item.
That's how you learn,
Yeah.
right?
There's a recurring line item across all of these. That's longevity. What does that mean?
So in all of our collective bargaining agreements, we do award years of service. So once you hit 5 years of service, most of them have a longevity payment of $700 once you hit that, and they increase over time as you have more years of service. So it's a way of rewarding longevity of employees.
Okay, so it's like you accrue that and then it gets paid out in cash, like whenever when the event happens, or do they get every year?
It depends on the union. Everybody's different, but some have them lumped all together at one pay date, and others hit their anniversary and are paid at that time.
Okay, thanks.
Is that for exempt employees as well?
Yes. Yep.
It's an interesting point. In most agencies, longevity precedes unionism. It's been around even before the unions came in, so it's been a long-established practice in government. That's it as far as, unless there's any questions on animal control, that's it as far as the departments are concerned. The select board is free to stick around and listen, or you can adjourn.
I'll entertain a motion to adjourn.
So moved.
Andrew, you want a second? Okay, I saw your lips. Okay, all in favor, John?
Aye.
Andrea?
Aye.
I'm an aye. Thank you, we're adjourned.
Good night, thank you for your.
Thank you.
Thank you, good night.
So we are left with our own internal business here, and we're gonna ask for some updates. The first update is Capital Planning Committee, and is Chris Green still here? And John Fryer is here as well, so can we get an update as to what the status with the Capital Planning Committee is?
Christina did leave.
Oh, she left?
Yep.
Okay. John Fryer's still there. Here we go.
Yeah, I guess Kristen's left. We've had a whole round of going through everything with the Capital Planning Committee. I hadn't planned to speak tonight. I assumed Kristen was going to do it, but that's all right. I'll do my best. So we've gone through everything, discussed everything. There's a follow-up meeting on Wednesday the 22nd, I think, to review additional items. So I believe, Dan, Kristen, you can correct me if I'm wrong, but that's to kind of finalize the capital planning requirements for the year. And we'll kind of go from there. I mean, there's one or two items that are a bit, I wouldn't say questionable, but there are being questions about. In particular, one was a bucket truck for the town versus using external services, you know, as it relates to tree trimming, in particular, also putting signs up, et cetera, versus some other kind of vehicle that can be used. And there's also quite a bit of discussion about what to do about the lights at the school playing field, the athletic field there, and also the field, the VFW field as well. They're both pretty old. They're not LEDs, for example. You know, there's questions about the safety of the poles. So quite whether we do one or whether we do both or whether we do neither, that's still a question that was a little bit sort of up in the air, but I think we'll get final answers. I think there was a belief that the school should be done at a minimum. And then the last other big thing is the athletic fields over on off Notting Road. They need to be replaced. They're aged out. I believe they're artificial turf at the moment. And there's also concern about, should it be artificial turf that replaces them? Should it be real turf? I think the added complication there these days is obviously it's adjacent to water there, the stream brook that's there, and any environmental impact that there might be if it's artificial turf. So again, that one's a bit up in the air.
That's a problem.
I don't know if I missed anything, Dan, Kristen, anything that you think we should add?
I would just add that on Wednesday of next week, we will be talking about the Robinson School feasibility study. That is something that the Capital Planning Committee had not discussed because the Robinson School feasibility study committee had just ramped up. They'll be meeting on Tuesday at midday via Zoom if anyone wants to participate in that meeting. And then they'll be providing a brief presentation to the Capital Planning Committee on Wednesday morning.
So that's capital planning. School committee, as far as a school committee is concerned, both Nate and myself are scheduled to meet with the school superintendent tomorrow at 2 to 3 to try to get further information on the proposal. Everybody's got the budget, so we'll be able to report on that. We should be ready to go with that next week when they come up. So I'll see you tomorrow at 2. Permanent School Building Committee. Beth, are you here? Can you give us an idea of what's going on?
I haven't been able to make the meetings, but I think we got an update on the I think the focus is the library, and we got an update on that from the library director last week. So I think everyone should be kind of up to date on that. I attended a few meetings like way back in the summer, and they were not really focused on the library. They were talking about the water department building, and the Rogers fire station, I believe, maybe was mentioned. But the primary focus, I believe, is currently is the library.
Just FYI, I think you were having the last, when the library presented, it indicated that there may be some delay in the construction of the library, so that might be something we want to keep an eye on.
So the Library Building Committee and the Permanent Town Building Committee met last night. There's not going to be a delay. They will be going out to bid the end of this month.
That's good to know. All right.
And just brief clarification for Beth's comments. The Permanent Town Building Committee is looking at the Namnasset Fire Station as that is under very preliminary contextual review.
Okay, thank you. We have the Community Preservation Committee. Shelby.
I do not have any updates. I think that they met to talk about this kind of round early in December when I wasn't available. So.
Okay.
There are 5 applications in. Just Jesse sent over some information. So there's about 1.2, 1.3 million applications. So it's a little bit of a lighter year compared to past years. So.
Okay. We have. Harry's not here for the clean energy and sustainability. Can you have any, either Chris or you, Dan, have anything you want to input on that? All right.
I can just say that the Clean Energy and Sustainability Committee are asking the Select Board to put in the opt-in stretch code for the spring town meeting. So that plans to be on the warrant. So that's one thing that may come before the Finance Committee for your review in the next few weeks.
And can you inform me what the stretch code is?
So currently the town of Westford is under the stretch code. That was, I believe, adopted by the town in 2013, if I'm not mistaken. There's now what they call an opt-in stretch code that requires that all new construction over a certain square footage is all electric. And if it is not all electric, that it has certain solar provisions and is hardwired for electric. There's actually going to be a public forum on this in early February. I don't have the exact date in front of me, so if anyone's interested in attending that forum, I believe it will be at Millennium on Zoom, and we'll have some public information going out in the next week or two on that matter.
That's very good. Thank you. Thank you very much for that. Nate, do you have anything on the Health Insurance Trust?
Sure. I'll provide just a summary of where I think we are, and I'll ask Dan and Kristen to correct me if I get any of it wrong. So the good news is that the trust's trending right now is better than where we were a year ago at this time in terms of utilization and claims. So that's a real positive. The balance of the trust also seems to be trending very much, Dan, in the right direction. So the bad news is that the increases needed to sustain that are still substantial, right? They may not seem substantial necessarily in the world of health insurance, especially for those of you who pay private health insurance and may be used to some of those from your own carriers. However, they are certainly substantial in the context of a community limited to Prop 2.5 that didn't have an override. So, and so therefore it continues to be a driver. We are working with the broker on monitoring that. There's been some exploration of what it might look like for other providers, including looking at the group insurance commission, looking at what's the acronym for the municipal?
Oh, the
Maya.
yeah.
Thank you. Sorry, it's late. The Maya municipal program, and looking at Mass General Brigham as a provider, as well as looking at mirroring GIC benefit levels, et cetera. So we continue to explore some of those as options. Kristen, I don't know if there's anything on the front of also looking at other forms of external help in terms of consultants at this time or not, but that was the only thing I was not aware of. Other than that, I think we have a meeting coming up next week as well. So I don't know if you had anything on that front.
Right, so we do have a meeting next week. The other thing I want to note is that the select board voted to allocate a substantial amount of ARPA funds into the health insurance trust. Dan probably has the number off the top of his head, which does help cushion us there. And I continue to have conversations with other potential consultants on what we may and may not want to do. Have not made a decision on that yet, and we'll go through that with the trust members next week.
I just have a question, either for Nate or for Chris. Has there ever been a definitive explanation about or an evaluation of the utility of moving to GIC? Have we ever had a actual evaluation as to whether or not it should be proposed or what? It's been out there talked about, but I've never seen anybody actually evaluate it.
Kristen, maybe I could take a stab at this and then ask you to
Sure.
add some context. This is something I've brought up to the Health Insurance Commission, to the Health Trust Fund rather, and had conversations with both Kristen and Dan about as well. The timing on that is a challenge with our plan, so I think that's one thing to keep in mind. Is our plan renews in the middle of the fall, and by the way, our reinsurance premium renews in the spring.
March, yeah.
In March, at the exact opposite time of the plan renewal, which is also complicated. The GIC start dates are annually July 1 is their annual renewal, start of their plan year. They offer a January start for municipalities to potentially come in, but then you'd be on the July 1. There's been substantial conversation about it. One of the things I've raised, Dennis, and I think Kristen's done a great job of trying to figure out how to address this, is that we are limited sort of in our own evaluation of what that might look like, and so on. I would point out there's also some concern, understandably so, that if you go with the Group Insurance Commission, that two things. One is that you're locked in from a cost perspective. So if the whole pool goes up substantially, you're going up substantially too. If the whole pool stays level, you're benefiting from that. The other concern that's been raised has been that going to a self-funded model takes time to realize that, and that we may, not have quite done that yet, and perhaps if we switch off of it too soon, or at this point anyways, we could lose the opportunity for savings down the road. I think both of those are valid points from my perspective. I also think it's still worth exploring, and sense to sense from the trust and from Kristen, a commitment to continuing to seriously explore that, to figure out dollar for dollar, in the long run, both in the short and long run, does it make sense or not?
That was a good explanation.
Chris, I don't know if Kristen has anything to add to that. I want to make sure, give her the opportunity.
Yeah. Chris, you want to add anything?
I think that was no, I don't think you, Nate. That was really comprehensive.
Yeah, that was very succinct. Thank you.
I don't know if it was succinct, but.
Well, it was pretty good. I mean, it was less than 5 minutes. You're doing all right.
There's a lot to cover.
Yeah. John, you want to talk to us about the Robinson School Building Committee?
Sure. We haven't had any meetings since I gave the last update. When was that, last week? Kristen kind of addressed the immediate kind of upcoming action items. I will say though that I came directly to this meeting from a tour of Robinson School, and yeah, it was interesting. For those who have not been, I would recommend you get a chance if you want to go there. I'm sure we can arrange a visit. But I've been in a lot of schools, and I have not seen a configuration like that before. So
Try reading to a group of kindergartners with another group of kindergartners in the same
or,
room, because I did
or
that.
3 groups, right? So
Yeah, 3
each
groups,
classroom
yeah.
is divided into 3 or 4, and like I said, I came here, so I haven't quite digested exactly what that means. But there's about 75 kids in one room, and they have bookshelves and little dividers between them. I don't know how they do that. So that was an interesting experience. So I feel like I understand some of the pain points a bit better, and I'm not sure having have somebody describe it to me quite captures it the same way as walking into there. So that's all I've got.
Okay, I'll just add, I haven't, I did some additional work on public safety with Selectman John Cunningham. We have met with the chief of police. We reviewed the budget with the chief of police. They'll be appearing next week, and we'll be able to give you a pretty good idea what their issues are. There's some interesting things that have occurred with them. And you had the fire department tonight, so as far as public safety is concerned, you're pretty much, with the exception of the police department, you're pretty much up to speed on it. And we should have it up. So as far as the additional schedule, is there any further information that anybody wants to either ask questions or disclose with regard to these board and committee updates? Anything we missed? Okay, everybody seems pretty satisfied. So our next meeting will be next Thursday, January 23rd, budget hearing. It'll be at the Millennial School, I think, is it?
I think so. Still have to secure the room, but I'll confirm with all the members.
Okay.
Yep.
It should be an interesting evening because the police department and the school committee are gonna be on at the same time, or the same evening, on the same schedule. So that's usually for good discussions when that shows up. And then that we'll be meeting every Thursday. We'll meet January 30th as well. And then we go into the February with the 13th and the 27th on Thursday. So the February 13th and February 27th. And we'll find out if March is necessary. But we're moving along, and we're making good progress. So I think that's it. So unless anybody has anything else, oh, what's that?
The minutes, Mr. Chairman?
Oh, yeah,
We
the minutes.
approve those? There was 2 sets of minutes on the bottom of the first page of the agenda.
Approval of minutes, all right. Is there a motion to approve the minutes of September 19th, 2024?
So moved.
Seconded?
Second.
There's a second by Shelby. Motion made by Nate and seconded by Shelby. Is there any discussion on the minutes? All right, seeing none, I'm going to call for the vote. I'll do a roll call because we're mixed. So we'll start. Nate?
Aye.
John?
Aye.
Shelby?
Aye.
John Fryer?
Aye.
Let's see. Beth?
Aye.
Sinji?
Aye.
And I'm an aye as well, so it's unanimous. So those are approved. Thank you very much. Is there a motion to approve the minutes for January 9th, 2025? Nate? Okay.
Just Christina had a couple comments, so as amended would be.
Where is Christine? Is she on?
She sent some comments to me, so I'll tell you what the changes were.
All right.
This is for the September or
The January 9th minutes, yeah.
This is the new one, okay.
John has a question as well.
Okay, go ahead. John?
I know it's a really small thing. I just got a spelling or a word that's not quite right. Page 4, line 3. It says, Warren said that throughout the year the water usage is usual fine. It should be usually. I know it's real small, but...
We'll fix that. Thank you, John.
What does Chris have?
That up. So
where is it? Page 4, line 3.
There was just a typo on the first page.
Yeah. It's just a typo.
Yeah.
It's usual instead of usually.
Yep. So and then we have.
That is fine.
Okay. So we can fix that, and then there's a typo on page 1 for competitive pay and benefits. It was completive, and Christina wanted to add in that she asked for a year-to-date program analysis for recreation for FY25.
Okay.
So I just noted that, and then she under library she added that she wanted to know about why the project was 3 months behind the original construction start date. So I think Ellen provided that info. So that was all.
Anybody have any objection to those additions?
As amended, move
Okay,
approval.
I see. Okay, so, motion by Nate. Is there a second? Okay, Sean? All right, let's take the vote. Nate?
Aye.
John?
Aye.
Shelby?
Abstain.
You're abstaining? Okay.
Yeah, I wasn't there.
I'll say yay. John Fryer? Aye. Beth?
Aye.
And Shinji?
Aye. Aye.
Okay, that passes. Motions, the minutes have been approved. And with that, I'll entertain a motion to adjourn.
Motion to adjourn.
Nate makes the, motion, who seconds?
Second.
All right, Shelby? So it's 8, Shelby. Let's vote. Nate?
Aye.
Aye. John?
Aye.
Shelby?
Aye.
Dennis is aye. John Fryer?
Aye.
Beth?
Aye.
And Sinji?
Aye.
All right, the meeting is adjourned. Thank you very much for your effort and your contributions.